doing this presentation for MUW. I'm working on my bachelor's program, and this was one of our prerequisites that we had to do. So thank you for coming. Our presentation today is on antibiotic resistance and what you need to know. Our objective is the antibiotic stewardship interventions have been proven to better individual patient outcomes, to reduce the overall burden of antibiotic resistance, and to save healthcare dollars. If everyone, healthcare providers, hospital administrators, policymakers, and patients work together to employ effective antibiotic stewardship programs, we can improve patient care, more effectively combat antibiotic resistance, and ultimately save lives within the next 5 years. What is antibiotic resistance? It's when drug resistance means that any drug classified as an antimicrobial that has been compromised or that is reduced or no activity when used to treat certain microbes. So the antibiotic is not able to fight the virus anymore. The antibiotics are designed to kill, stop, or slow growth of bacteria and some fungi, while an antibacterial substance is designed to kill or slow bacterial growth. Drug resistance occurs when microbes survive and grow in the presence of a drug that normally kills or inhibits the microbe's growth. In India, 58,000 babies died in 1 year from super-resistant bacterial infections, which are usually passed from their mothers. In the European Union, antibiotic resistance causes 25,000 deaths per year and 2.5 million extra hospital days. In Thailand, antibiotic resistance causes 38,000 deaths per year and 3.2 million hospital days. Each year in the United States, at least 2 million people become infected with bacteria that's resistant to antibiotics, and at least 23,000 people die as a direct result of these infections. While antibiotics are life-saving drugs that treat bacterial infections, they're not without risk. Taking antibiotics increases your risk of getting an antibiotic-resistant infection later. Antibiotics kill the healthy bacteria in the gut, allowing more harmful bacteria such as C. diff to grow in its place. Although this infection is commonly found in hospitals, it also occurs in clinics outside the hospital. Antibiotics cause 1 out of 5 emergency department visits for adverse drug events or allergic reactions. Antibiotics are the most common cause of emergency department visits for adverse drug events in children under 18 years of age. In 1983 to 1987, we had 16 new antibiotic agents. In 2008 and 2012, there's barely even any in there. So they're not coming up with more like they originally did. And you know, Mississippi's always the hot spot. Mississippi, it says on here that 50% of all antibiotics prescribed in U.S. health provider offices are either unnecessary or inappropriate. The yellow color is the lowest amount, and the dark burgundy there is the highest. So let's see what a viral infection is. It's an infection caused by a virus. Viral infections cannot be treated by antibiotics. Colds or flu, coughs and bronchitis, sore throat, runny noses, herpes, chickenpox, and hepatitis are all viruses. How are they spread? Cough, sneezing from vomit, bites from infected animals or insects, exposure to infected body fluids, forgetting to wash your hands after handling pets and animals is another way for germs to be taken in by the mouth. If you're sick with a virus, what can you do to feel better? Get plenty of rest, drink plenty of fluids, use a clean humidifier or a cool mist vaporizer, breathe in steam from a bowl of hot water or a shower. Use lozenges. Do not give lozenges to children younger than 4 years of age. Ask your healthcare professional or pharmacist about over-the-counter medicines that can help you feel better. What's a bacterial infection? It's an infection caused by bacteria. The growth of many disease-causing bacteria can be halted by the use of antibiotics. Types of bacterial infections: tetanus, strep throat, cat scratch disease, pneumonia, Rocky Mountain spotted fever, Legionnaire's, cholera, gonorrhea, anthrax, syphilis, typhoid fever, and meningitis are all types of bacterial infections. How do they enter your body? They enter through cuts in the skin, through contaminated food or water, close contact with an infected person, feces of an infected person, breathing in exhaled droplets when an infected person coughs or sneezes, indirectly by touching a contaminated surface such as taps, toilet handles, toys, and napkins. So how can we prevent getting a bacterial infection? Hand hygiene. Wash your hands, wash your hands, wash your hands. Make sure you and your child are up to date with all your recommended vaccines. Don't smoke and avoid secondhand smoke, chemicals, dust, or air pollution. Always cover your mouth and nose when coughing or sneezing, and keep your distance from others when you are sick if possible. When to seek medical care: if you have a temperature greater than 100.4 degrees, if your cough has bloody mucus in it, if you're short of breath or you have trouble breathing, your symptoms have lasted more than 3 weeks, or you have repeated episodes of bronchitis. What should you do? Ask your healthcare professional about what you can do to stop or slow down antibiotic resistance. Ask your healthcare professional if there are steps you can take to feel better and get relief from your symptoms without using antibiotics. Take the prescribed antibiotic exactly as your healthcare professional tells you. Safely discard any leftover medication. Don't save it for the next time you're sick. If you've been prescribed an antibiotic, use it all like you're supposed to. And there's tips on how to discard unused medications from the Food and Drug Administration. Ask your healthcare professional about vaccines recommended for you and your family. Vaccines are an effective way to prevent infections that may require an antibiotic, and they're also an important way to keep diseases from spreading. Never take antibiotics for a viral infection like the cold or the flu. Antibiotics do not cure viral infections, such as these we've mentioned: colds, flu, sore throat, some ear infections, and sinus infections. Never pressure your healthcare professional to prescribe an antibiotic. Never skip doses or stop taking an antibiotic early, even if you no longer feel sick, unless your healthcare professional tells you to do so. Never save antibiotics for the next time you become sick, and do not take antibiotics prescribed for someone else. Taking the wrong medicine may delay correct treatment, allow bacteria to multiply, and cause unwanted or severe side effects. Discard any leftover medication. So what's happening with healthcare? Healthcare is getting together to do a coordinated approach. You've got the public health departments. They're using health-acquired infections and antibiotic resistance data to target infection prevention and outbreak control. They're keeping up with what's resistant to what. They're enhancing communication between facilities for patient transfers, and they're improving infection control, prevention, and antibiotic stewardship across healthcare communities. The healthcare facilities. They're using the CDC's National Healthcare Safety Network and other data systems to track the resistance, antibiotic use, and to target prevention. They want to share the information and work with local public health authorities to prevent and control infections. They're going to send isolates to the antibiotic resistant lab network to identify outbreaks and emerging threats to health authorities. The Centers for Disease Control they're going to detect, track, and control outbreaks. They want to promote infection prevention and appropriate antibiotic use. They want to detect antibiotic resistance by providing a gold standard laboratory method and isolates that support development of new diagnostics. So it's up to you. Improving antibiotic use starts with you. Using antibiotics wisely is the best way to ensure that they work for future bacterial illnesses and prevent unnecessary side effects.